there's no integrative medicine category. So
Yeah.
I kind of figured if I'm to wait for them to enter integrative medicine category, it's a lost cause. So I just applied geriatrics. Okay, well, welcome everybody. Hope you're having a good week, and congratulations on a long weekend and a upcoming holiday. So I have a couple of interesting things today. Let's start with bad news. You've all been seeing and hearing what I've predicted last month in terms of massive uptick in cases. We are basically already matching, if not surpassing, last year's peak. I expect getting things a lot worse. I don't think we're going to go into lockdown, but I've been wearing masks now everywhere, even when I go to stores, because basically now statistics is such, if you're not protecting, you will get sick. I can nearly guarantee you that, just because of the sheer volume of ongoing cases. We have about 1,500 deaths per week, which is much less, thank God, than before. I think this has to do with the fact that the current variant, the JN1, is much milder, thank God. But I expect that it will continue increasing for a while, partially because it's the most virulent strain we've ever had, and it'll probably keep getting more virulent, but not more severe. So that's in short. There is no change in how I recommend vaccinations. We've discussed that several times. But there's one new interesting treatment, which is not very new. It's very old. So I'm going to post most recent video I just finished a couple of minutes ago on the YouTube. Where's the chat? Oh, there we go. And so should you be gargling with the salt water and doing nasal washes? And absolutely yes. Pretty dramatic result if you look at the study that I discuss on this video. So I do recommend take your time and watch it. It's very short, it's 6 minutes. You can watch it after we're done today. Unfortunately, the data is not going to be easy to translate to today's variant, because this was collected, the study was done between 2020 and 2022. At that time, the hospitalization rates were much higher, so the protective effect of gargling may have been a lot better. I do strongly recommend adding propolis. Those of you who've been my patients know that I'm very aggressive at saying add some drops of propolis into either neti pot or the gargling solution for the back of the throat. I do think it significantly enhances efficacy. Adding iodine is another option. Some physicians recommend this. I don't. I think iodine could be a little problematic for some people. They may also not feel very well with that. It may be a little, maybe they're hurting. So that's very, very valuable. So that's my COVID recommendation, COVID update. And then also, if you haven't seen I promise that I will meet and interview Dr. Ekstrom, who's the chief of geriatrics at OSU, and she's the author of this recent study published in Annals of Internal Medicine, which is like top whatever tier journal in the world, basically showing dramatic cognitive enhancement in normal aging adults of Tai Chi in combination with a basic cognitive exercise. So I finally gotten to do the interview. I'm posting the full video in the chat. Please do check it out. The effect was so dramatic that, and this is the second study they're doing showing this dramatic effect. So basically, it completely blocks any cognitive decline in people over 65. So they basically reversed the starting point of MoCA test was around 25 to 26, and at the end of the study was 29. As I said in the interview, this would be a drug. You will be hearing about this at every corner of the world instantly, and it will be the bestseller shining out every other medication on earth. That is the level of efficacy. It's not surprising. Anybody who's taking up serious Tai Chi practice knows very well there is a significant cognitive enhancement. The interesting aspect is this combination, adding cognitive training while you're doing Tai Chi. That seems to be the goal. I'm pretty sure that we're going to see more studies on this. I'm sure we're going to see a practical program out of this. I will figure out how we're going to get trained in delivering this exact protocol they've done in the study, because obviously it makes sense to do so. That's all I have for today. I'm sorry about the COVID news being so bad. It is what it is. I think we sort of anticipated it, so stay protected. Gargle if you get it. Actually, question is, should you gargle prophylactically? I think the data is also there, although this study in the video is just discussing the gargling for the active infection. But I think for prophylaxis, it's very good too. It's also great to just kind of wash off the nostrils during a very dry weather. I feel like it's often very helpful, especially for those who feel very dry early in the morning or during the day, especially if you're in the forced air kind of heating situation where the air can get much drier than you kind of comfortably like. So I promised Cynthia I'll take no more than 15 minutes, so that leaves about 5 minutes for Q&A. I see Benito posted a couple of things. So yeah, green tea is very good. It is very strong antioxidant. So yeah, so gargling, I would probably use matcha. That would be my recommendation if you're going to do it that way. But of course, there's a lot of other recommendations for a sore throat. Whether that actually helps you to shorten the length of whatever the viral infection is going is not very clear. But of course, soothing an acute illness is also a good idea. So if you rather unmute yourself and ask the question, do so. Otherwise, put them in the chat.
I have a question, of course. Did you say that it's actually worse than last year?
Much worse, yeah.
Wow.
The number of cases is much worse. We're not being informed because the tracking is not there, but I'm comparing to what I'm seeing in a clinic. Last year, we've had 1 or 2 patients a week. Right now, we're having 3 to 5 patients per day calling us with active COVID. We have several of our staff members who just had it. So it's definitely worse. We're just not being tracked. It's also worse probably because there's just simply more, there's just a lot less protective mechanisms, right? There's more travel, there's no masking whatsoever. I find myself wherever I go with the K95 people looking at me funny. I don't care. But although we went to a play a couple of days ago, highly recommended. Fat Ham at it's kind of a new variant of Hamlet. It's amazing. It's great. Great play. And we actually probably about at least 10%, if not 20% of people were masking in the auditorium. So I was very pleased to see that. I was expecting just walking in being masking only me, but there were a lot of people with masks. So I felt good about that.
That's better than up here. I went to see Come Fly Away, which is great, but huge theater, super crowded. I would say hundreds of people.
Nobody masks, right?
No one really masked.
Yeah. So I posted something on Facebook recently, statistics on percent. If you're in a crowd of 200 people for more than 30 minutes, you're getting sick, period. 100% certainty right now. That's basically the statistics.
One more follow-up and then I'll shut up, if I may. So then does it make sense to wear masks? Is it worth it? Is it gonna do anything?
Masks, K95, yeah, the data is super clear. It's 100% protective, nearly. So, I mean, I wouldn't wear a surgical. I think surgicals are useless. But the K95, you drop your risk dramatically. You basically, the only way you're going to get infected if you're wearing K95, if somebody sneezes or coughs right in your face and you have no eye protection, you could get infection into your eyes and get just as infected. But that is not as easy to get. But, you can use, of course, N95s. The problem is that N95 is even harder to breathe with. So, and also they're hard to find to being comfortable fit. The ones I use are not the ones that go behind the ear. I find those uncomfortable for myself. I have the ones that go in the back like this. and whether they're N95 or K95. But the data on masks is super clear. There's no actual discussion about it, no matter what kind of videos you see on YouTube. Most of them are garbage. So masks are highly effective at protecting you. Now, they're not highly effective at protecting others. So if you're coughing and you are a source of infection, I think surgical mask is just as good as anything. Because remember, when you're coughing, you create the positive pressure, and so there's going to be escape from underneath and from the sides of the mask. You can't fully prevent it. So, but masks protect you more than they protect others. All right, there's some other questions coming, so let's take them and how they came. I see Salome had a hands up, but just give me a second. I'm going to go to the chat. Tai Chi for arthritis. Start with the intro. So yeah, there's a lot of videos on Tai Chi on YouTube. When you watch my YouTube video, you'll see a link to the teacher in the study. I would be careful at recommending types of videos that are long and they're not very evidenced. Most of the studies on Tai Chi are done with a 24 young or shorter forms. You don't have to learn anything really advanced. Holden is probably the largest viewed teacher. He's got a very comprehensive program, but you can also just watch a lot of his free videos. I like him. There are some other teachers I like. I think Polem is good too. So there's a lot of options. I would just suggest when you start watching it, start with, if you've never done it, then you're going to do the video. Start with something that's no longer than 10 minutes so that the actual practice is short. You can always grow it in the future if you like. The studies with the Oshu studies, they were with 8 movements Tai Chi, and it was just as effective as 24. So I don't think there's evidence to suggest that the longer forms or more complex practices are better. Okay, so next question. Remember saying that one study found Paxlovid didn't. Correct. There's an increased concern that Paxlovid is barely effective. So I am very much more cautious in recommending it now. The recent study has just been coming out. CDC seems to still aggressively push Paxlovid. Why that's happening? I think it's because simply the newest variant is simply more resistant and it's milder. It's harder to show a benefit when the disease is mild. And most of the cases we've seen are becoming even milder. So we've seen very few complications. I actually, to be honest with you, lately I've been seeing more complications when people would have a COVID plus something else at the same time going on. I think those are the people who end up in hospital and dying, not people who just have straight COVID and they have no other problems. I think the mortality from cases like that is now negligent, probably comparable to flu. Just the problem is that the COVID causes a bunch of other issues to be sort of exacerbated versus flu does. I think that's really what we observe. Okay, I'm a couple of minutes over, so I'll just take last questions and then I will pass it to Cynthia. Names of my Tai Chi videos I like are in the link above. So I'm going to repost this. This is the second link. When you watch this full-length video, if you don't have to watch it, but what you can do is you can just go to this link and the links to the Tai Chi videos I recommended there. And I think Salome has her hand up, so I'm just going to honor that as the last question. Salome, do you want to unmute yourself? Maybe it's just a hand up and you don't want to ask me. Hello? We can't hear you. All right. While I'm waiting, I want to give Salome a chance to ask her question. Elisa put an interesting question in the chat saying, is there evidence for Paxlovid for risk of long COVID? There was, and I think there is some evidence. Again, the problem is that this is all going back, right? So this is 6-12 months ago. Does that translate to the recent variant, especially with the studies showing now that Paxlovid doesn't seem to dramatically change the severity of the disease? I don't have an answer. Basically, my policy changed. Before, I used to give Paxlovid to pretty much everybody. You want Paxlovid, you get it. If you're over 65, I just write it. Nowadays, I'm looking at this a little different. I'm a little bit more cautious. So I still would give you if you want it. I'm not going to argue, but the way I think about this is if there's any inclination. Oh, let me give you an example. I just refused to, well, not refused. I just talked out a patient who's 93 who was in a day 4, and he's on 3 medications that have interactions with Paxlovid. And I kind of said, look, we can stop all these 3 medications, but you may start getting a lot more symptoms of some of the things. I'm not going to give specifics here. And then we just agreed not to do it, and he's fine. He's recovering just fine. So. All right, with that, I'm going to get rid of my spotlight. And Cynthia, as always, so wonderful to have you here. We're going to hear about MBSR and whatever else is going on with you, and also some of the upcoming fascinating things. I do want to mention before I kind of get off of this that we're going to have a mental health and trauma open virtual house for the clinic on February 2nd, right after our February 2nd this meeting. So it'll be at 3 p.m. I will post a link to the program in a minute as Cynthia is taking over. Thanks, everybody.
And thank you for sharing such incredible, important information about COVID, wanting to keep us, of course, safe and well. Hello, everyone. I am delighted to be back with this wonderful group, and I'm going to provide you with a relatively brief overview of MBSR, share some information on upcoming events that you might be interested in, and then I'm going to share with you a guided practice that was actually created by Dr. John Kabat-Zinn. So I'm going to share my screen and move it over. Let's see here. Okay, I want to make sure that you can see it properly here. There we go. Okay, can everyone see my screen? Yes, okay. So mindfulness-based stress reduction, as you may already be aware, is also referred to MBSR. It's also considered the gold standard of mindfulness training. And in this very brief overview, my goal is just to assist you in recognizing perhaps what to expect by taking the evidence-based 8-week MBSR course if you choose to. Again, this was developed by Dr. John Kabat-Zinn, who's an internationally known professor of medicine, a scientist, as well as an experienced practitioner. So I'll just start with what is meditation. You may certainly already be familiar with this. The National Institute of Health describes it as a mind and body practice that certainly has a long history of use for increasing calmness and physical relaxation, certainly assisting with psychological balance, individuals coping with illness, as well as assisting individuals enhancing overall health and well-being. And again, as you may be aware, mind and body practices focus on the interactions among the brain and the body and behavior. Now, we focus on what meditation is, just a few moments to focus on what meditation is not. It is not a religion. It does not require a specific background or special skills. It certainly does not demand a significant amount of time every day. Unfortunately, it doesn't eliminate sadness or challenges that we may be experiencing. And it really is an attempt to stop thinking or insist on only positive thoughts. The focus is really on being intentional and maybe shifting our mindset a little bit more toward a response, a mindful response to situations and circumstances in our life versus a stressful reaction. So many different types of meditation, again, that you may already be aware of. Most of them have the following elements in common: a quiet location with very few distractions. You could be sitting, standing, lying down, a focus of attention, which could be a chosen word or an object or sensations of the breath, which we'll be practicing in just a few moments. And also an open attitude, which essentially means letting distractions come and go naturally without harmful judgment. So what is mindfulness? And again, you may already be familiar with this. I tend to turn to the definition from Dr. John Kabat-Zinn. Mindfulness means paying attention in a particular way on purpose and in the present moment, non-judgmentally. Another way of viewing this is paying attention to our thoughts, our feelings, our bodily sensations, as well as the environment around us without harmful judgment. So mindfulness is really a skill that can be developed through practice, just like any other skill. It may be helpful to think of it as a muscle. The muscle of mindfulness can grow both stronger and more flexible the more that we use it. It's also important to keep in mind that mindfulness is not really a technique, although there are many different ways to practice mindfulness. And it's not about achieving some special feeling or a special state. It's really about recognizing that whatever feeling we are having or whatever sensation, we have the ability to embrace it with larger awareness and perhaps find new ways through mindfulness and perhaps through MBSR of navigating life. So it might be helpful to keep in mind that mindfulness is all about being aware. When we're being actively mindful, we're noticing and paying attention again to our thoughts and our feelings and our behaviors, as well as the effects that we may be having on those around us. And we can practice mindfulness anytime, anywhere, with anyone by showing up and being fully engaged in the here and now. And mindfulness can be practiced both informally, which is at any time and place, and formally, which is typically during seated meditation or standing meditation. So where meditation is usually practiced for a specific amount of time, mindfulness can actually be applied to any situation throughout the day. So I'm just going to give you a really quick overview on the neuroscience. Recent research in neuroscience shows that we have the power to influence our brains. Neuroplasticity, as you may already be aware, is the ability of the brain to change by creating and reorganizing neural connections, especially in response to learning or experience, particularly if those experiences are novel and positive. So neuroscientists often refer to the prefrontal cortex, also known as the mindfulness module of the brain. It's more active during relaxation response. And this leads to an improvement in emotion regulation. And again, a wise response versus a reactive or impulsive or fear-driven response. So when we're engaging in mindfulness and mindful meditation, parts of the brain that are related to attention, sensory processing, emotion, as well as stress regulation are strengthened. So each moment really offers us the opportunity to notice our current state, shift our attention, and then actually rewire key neural pathways. So MBSR, it began in 1979, again through Dr. Jon Kabat-Zinn, the creator at the University of Massachusetts Medical Center. It's a well-defined, systematic, patient-centered educational approach, which uses relatively intensive training in mindfulness meditation as the core of the program to help individuals learn how to take better care of themselves, perhaps, and live healthier, more adaptive lives. So the original intention for MBSR was as a public health initiative to kind of shift the bell curve of humanity towards greater health, well-being, and wisdom, as Jon Kabat-Zinn has said. And research on the program has helped establish MBSR as a viable intervention for a host of physical, emotional, and psychological conditions. And MBSR can help support primary, secondary public health goals, preventing illness and disease, and also cultivating inner resources that help support resilience and coping, and also dealing with the effects of chronic, long-standing conditions. So MBSR is now offered in over 720 medical centers, hospitals, and clinics around the world. And Jon Kabat-Zinn has contributed to a growing movement of mindfulness into mainstream institutions, in addition to medicine and healthcare, including primary schools, higher education, corporations, prisons, the legal profession, and professional sports. So there are numerous benefits of mindfulness meditation that research has demonstrated. Again, it's a method by which attention skills are cultivated, emotional regulation is developed, and rumination and worry can be significantly reduced. So during the past few decades, mindfulness meditation has been the subject of significant clinical research, which suggests that its potential benefits can be helpful for mental health and physical health, including reducing stress and anxiety, improving focus, enhancing emotional resilience, increasing productivity, as well as enhancing interpersonal skills. So over 3 decades of research suggest that mindfulness instruction can improve mental health, quality of life outcomes in both clinical and non-clinical populations. And again, just a list of how mindfulness is shown to be effective in helping people who suffer from a variety of health challenges. It's also important to keep in mind that mindfulness and MBSR is really not a cure-all. It is really a tool for your toolkit, self-care tool. And some of these benefits that are listed on the screen, mindfulness and MBSR is used along with other medical and psychological treatments. So I thought I'd do just a very brief focused attention practice with you. So I'm just going to invite you to be in a comfortable position. Again, this can be sitting, standing, or lying down. It's just going to be for a few minutes. And once you're in that comfortable position where you feel relaxed yet alert, I'm going to encourage you to close your eyes or gently lower your gaze if you feel more comfortable. And perhaps just taking a few deep breaths and feeling the sensations of breath within the body. There's no need to think about the breath. There's no need to change the pace of the breath. Just letting the breath be natural. And keeping in mind that the mind and the body and the breath are intimately connected and can influence each other. So the invitation is to take a few moments to sense what it means to you to arrive into this present moment. And feeling the movement of the breath, maybe you feel it most succinctly in the nostrils or the throat or the chest or the abdomen. Just feeling the movement of the breath. And allowing your senses to be aware of what's occurring around you. Perhaps noticing sounds in the room. Perhaps noticing the sensation of your body touching the chair or touching the floor. Again, just becoming aware of the sensations throughout the body. Tuning in inwardly to see whatever may be present, any thoughts or emotions or bodily sensations that may be arising. Being kind and gentle with yourself in this process. And as we bring this brief practice to a close, I invite you to bring some gentle movement to the body if that feels right for you. Could be wiggling the fingers and toes or gently moving the neck and the head from side to side. Gently opening your eyes if they've been closed whenever you're ready. And I'll go ahead and I'll share a little bit more of the specifics about the MBSR program. So again, as I mentioned, it's an 8-week evidence-based program. It is secular intensive mindfulness training. There's over 30 years of scientific research focusing on the benefits and a variety of mindfulness practices, including what we just did, which can be reviewed or viewed as a focused attention. Also in mindfulness and MBSR, we engage in mindful movement, as well as exploring patterns of thinking, feeling, action, and behavior toward effectively managing stress. So again, these are some of the practices that are involved in the MBSR program: mindfulness of the breath, body, and sounds, a body scan, mindful eating, awareness of stress reactivity, a loving kindness practice, talking about and reflecting on how to mindfully communicate effectively, and again, mindful movement, which some of this or all of this you may have already engaged with, so this might be a refresher for you. So what to expect in the program: experiential mindfulness practices, as was mentioned. There'll be educational material about the mind-body stress response. There will be homework involved as well that is connected to what we're discussing during class time. There is a huge focus on confidentiality and safe space. Kind of like what happens in our MBSR course stays in our MBSR course. There's a large group and there's small group discussions. There is a commitment to practicing at home, and I'll certainly go into greater detail during the orientation that we're having later this month. And then there's also an all-day session. So again, this is an 8-week program and 2.5 hours per week. And the all-day session is typically 9 a.m. to 4 p.m. However, that time frame can certainly vary. So using mindfulness to shift to healthy states of mind, really focusing on building 4 skills that reduce stress and hopefully increase well-being. So moving from an autopilot state where we're hashing the past or rehearsing the future and really focusing on the present moment. Moving away from stress reactivity, which can have such a negative impact on the mind and body, moving to a wise response, really taking a pause, if you will, before taking intentional action. Moving from emotional stress state to more of emotional resilience. And moving from an inner critic, which we all have, to a more compassionate voice. So when we're in autopilot, we may be carrying stress and tension in the body without even knowing it. We may not be recognizing critical information that we need before making an important decision. We also may not be present during some really special experience in our lives, moments that really contribute to life meaning and purpose. So again, it's helpful to think of mindfulness as a muscle. The more we use it, the stronger and more flexible it becomes. Mindfulness can really help to create a space between our stress triggers and our reactions and be able to choose a healthy response. And you may have heard from the quote from Viktor Frankl, this following quote, between stimulus and response, there is a space. And in that space is our power to choose our response. And in our response lies our growth and our freedom. So just some upcoming events. Again, both of these events will be virtual. They'll be through Zoom, through the GW Center for Integrative Medicine. The first is a mindfulness retreat. This will be held on Sunday, January 21st from 2 to 5 p.m. Nina Paul, who is another qualified MBSR teacher, and I will be leading this retreat. Very much looking forward to it. Another thing I'm looking forward to is the next MBSR 8-week course that I will be providing, again, through the GW Center for Integrative Medicine. The orientation is going to be Wednesday, January 31st at 6:30 p.m. And the first class will be Wednesday, February 7th from 6:30 to 9 p.m. If you would like additional details about this event and how to register, they're available on the GW website, as you can see on the screen, gwcim.com. However, you can also reach out to me if you have any questions about mindfulness in general, MBSR in general, or perhaps these 2 upcoming events. So here is my contact information, Cynergy Wellness Group at gmail.com. And I'll also put that in the chat after our guided practice, if that would be helpful for you. But I know I covered a lot of information in a short period of time. Before I move on to a longer guided practice, again, this is a close version to what was created by Dr. John Kabat-Zinn. I just wanted to see if there were any questions about MBSR or what's been covered.
I just want to point out, those of you who want to get the slides, do notice that when we post everything, the slides will be in the recording. I don't know if there's an easy way to actually get you a deck of slides. I don't think we usually do that. We just share the handouts unless Janet has another way of stating what I just said. And yes, and if you need to, you can unmute and we can take a couple of minutes before Cynthia starts longer practice if you have questions about everything she just presented. All right, well, if any questions come up, drop them in the chat. Maybe we'll have a couple of minutes after the longer practice. And thank you, Cynthia.
Sure, my pleasure. And now we'll go ahead into the mountain meditation. Again, this is a guided practice. And the mountain meditation is normally done in a seated position, either on the floor or in a chair. However, if you feel more comfortable standing or lying down, the most important thing is that you take good care of yourself. If at any point you need to move, or you want to shift your attention, or you want to move out of the practice, please know that you can do that. This is completely about you, your self-care, and your time. So again, I'm going to invite you to be in a comfortable position, finding a stability and power position, if you will. Just feeling comfortable yet relaxed. Maybe the upper body balanced over your hips and shoulders, your hands on your lap or on your knees. And just taking a few moments again to sense into your body. Feeling your feet, your legs, your hips, your lower and upper body, your arms, shoulders, head and neck. And the invitation once again is to allow your eyes to close, or perhaps they just have a gentle gaze toward the floor, bringing awareness to the breath, bringing awareness to actual physical sensations in the body, and feeling each breath as it comes in and it exits the body. And letting the breath just be as it is. No need to try to change it or regulate it in any way. Just allowing it to flow and to be natural, with its own rhythm and pace. And being aware that in this moment there's nothing for you to do, nowhere you need to go. And the invitation is just again focus on this present moment. And then if possible, allowing the body to be still. Perhaps sitting or lying down with a sense of dignity, a sense of resolve, a sense of being complete. And now the invitation is to let an image form in your mind's eye. An image of the most magnificent or most beautiful mountain you know, or have seen, or can imagine. Letting it gradually come into greater focus. And even if it doesn't come as a visual image, just allowing the sense of this mountain, feeling its overall shape. Perhaps its lofty peak or peaks in the sky. The large base rooted in the bedrock of the Earth's crust. Perhaps it has steep or gently sloping sides. And just taking a moment to notice how massive it is, how solid, how unmoving, how beautiful. whether from afar or up close. And perhaps as you hold that image in your mind of the mountain, perhaps your mountain has snow blanketing its top and trees reaching down to the base. Maybe there are streams and waterfalls cascading down the slopes. Again, there may be one peak or a series of peaks, perhaps with meadows and high lakes. And just taking some time to observe this image of the mountain. Noticing its qualities. And when you feel ready, the invitation is to see if you can bring the mountain into your own body, sitting here or lying here, so that your body and the mountain in your mind's eye become one. So in this moment, you share in the massiveness and the stillness and the majesty of the mountain. You become the mountain. So at this moment, perhaps your head becomes the lofty peak, supported by the rest of your body and affording an amazing view. Your shoulders and arms are the sides of the mountain, and your legs are the solid base. And perhaps with each breath, becoming a little bit more of a breathing mountain, alive and vital, yet unwavering in your inner stillness. Being completely who and what you are, beyond words, beyond thought, a centered, grounded, unmoving presence. And perhaps becoming aware of the fact that as the sun travels across the sky and the lights and the shadows and colors are changing virtually moment by moment in the mountain stillness, the surface teems with life and activity. Perhaps streams, waterfalls, plants, and wildlife. And as the mountain sits, seeing and feeling how night follows day and day follows night. Maybe the bright warming sun, followed by the cool night sky studded with stars, and the gradual dawning of a new day. And through it all, the mountain just sits, experiencing change in each moment, however, constantly changing, and always just being itself. It remains still as the seasons flow into one another and as the weather changes moment by moment. Calmness, abiding all of change. And in any season, the mountain may find itself at times enshrouded in clouds or fog or pelted by freezing rain. However, none of this matters to the mountain, which remains at all times its essential self. Clouds may come and clouds may go. The mountain's magnificence and beauty are not changed. It just sits, being itself. And through it all, the change of seasons, shifts in weather, the mountain continues to sit, unmoved by what happens on the surface and by the world of appearances. And in the same way, as we sit in meditation, we can learn to experience the mountain. We can embody the same central, unwavering stillness and groundedness in the face of everything that changes in our lives over seconds, over hours, even over years. So in our lives and in our meditation practice, we may experience constantly the changing nature of mind and body and of the outer world. We have our own periods of light and darkness, activity and inactivity. And it's true that we experience storms of varying intensity in the outer world and in our minds and bodies. We endure periods of darkness and pain, as well as moments of true joy and uplift. Even our appearance changes constantly, expressing a weather of its own. By becoming the mountain in our meditation practice, we can link up with its strength and stability and adopt it for our own. We can use its energies to support our energy, to encounter each moment with mindfulness and equanimity and clarity. It may help us to see that our thoughts and our feelings, our preoccupations, our emotional storms and crises, even the things that happen to us, are very much like the weather on the mountain. We may tend to take it all personally, but its strongest characteristic is impersonal. It's important to keep in mind that the weather of our lives is not to be ignored or denied. It is to be encountered, honored, felt, known for what it is, and held in awareness. And in holding it in this way, we come to know a deeper silence and a stillness and wisdom. So if you find that you resonate in some way with the strength and the stability of the mountain, it may be helpful to use this from time to time in your meditation practice to remind you of what it means to sit, stand, lie down mindfully with resolve and with wakefulness and in true stillness. And as we bring this practice to a close again, feel free to bring some gentle movement to the body, perhaps stretching out the arms and legs, just moving in a way that honors your body in this present moment, or just remaining still if that's what feels right for you. And gently opening your eyes whenever you're ready. Again, I want to thank you for this time. And feel free to reach out to me if you have any questions or would like additional information. And I hope you stay safe and well. Thank you.
Thank you, Cynthia, so much. If anyone else have a question to Cynthia, please drop it in the chat. Otherwise, we'll see you next week. I don't know if Janet is here. Janet, who do we have next week?
You and a yet to be determined person.
Very good. Me and yet to be determined person. We'll see you next week. Everybody enjoy long weekend. Stay safe, stay warm.
Thank you, Cynthia.
You're welcome. My pleasure.
Thank you.